Do you foresee that, we're to a point where we're going to start seeing more and more practices start to kind of change over and more practices adopt it? And when are we going to get to a point that we're actually going to see every practice adopted and it's no longer even a thought process, if you will? And you will be out of a job. I hate to say it, but to exactly what you had said before.
Yeah, I know. Hopefully my kids will be out of college by then. Yeah, and it's a great question. So we are sort of really in a real transformation period in health information technology. It's one of the few growth areas of the economy right now, and the economy in general seems to be turning. But really over the last year or two, health information technology has been one of the few areas, the few bright spots of real significant growth and real significant innovation of the type that that all of us, I think, get excited about when we think about economic growth and the things that technology can do. So one of the things that has really fundamentally changed the market is that as a part of the economic stimulus that was passed right after President Obama was elected, there was about $30 billion put into a set of incentives that are provided to physicians and to hospitals to adopt electronic medical records and use them in ways that improve the efficiency of care and improve the quality and safety of care. So that's really changed over the last couple of years, the dynamic, as it were, so that almost every hospital and almost every physician that's in the system is thinking very hard about when they're going to be implementing electronic health records so that they can take advantage of these incentives. And the incentives are significant. If you're a primary care physician, or if you're a physician who sees a lot of Medicare patients, which is almost most physicians in the country see enough Medicare patients to qualify for this government incentive, you can get $44,000 for using an electronic health record in certain ways that the government is asking you to use them. And those ways are not outlandish or crazy. They're things like document a patient's record electronically. Get an electronic lab results interface so that you get the lab results as soon as they're available from the lab. Set up a way so that patients can securely receive messages from you. All of us have had the frustrating experience of using email, Twitter, Facebook, in every part of your life except for medical care, right? And you're thinking, Why can't I just email my physician and get a response back? And so what these incentives say is that you as a physician need to think about how to do that. We're in a new world right now. You need to do e-prescribing so that the physician doesn't hand you a paper prescription. You just tell that physician, I go to CVS or Walgreens in West Newton, Massachusetts, and you show up and your prescription will be there. So that's really, fundamentally changed, the conversation here, so that almost every physician that I know of is not thinking about if they should get an electronic health record, but they're thinking about when.